erector. So if we have a deep perineal pouch, we're also going to have a superficial perineal pouch. Now I suppose the ultimate inferior limit of the superficial perineal pouch is going to be the skin. Although that's not necessarily true, because just deep to the skin we have a layer of subcutaneous tissue, so this subcutaneous membrane, and this is an important membrane, and it's actually known as Cole's fascia. So the inferior limit of the superficial perineal pouch is going to be this layer of Cole's fascia. The superior limit of the superficial perineal pouch is going to be the perineal membrane. Now the contents of the superficial perineal pouch are mainly the erectile bodies of the penis, or the clitoris in the female. And we're going to draw these erectile bodies in. First of all, we need to complete the urethra, because once the urethra here has passed the perineal membrane as the intermediate or membranous urethra, it then courses anteriorly to enter the bulb of the penis. And here we're going to have to appreciate that the urethra is actually now coming anteriorly out of the screen towards us as it runs in the bulb of the penis. But surrounding the urethra at this point is going to be corpus spongiosus. The corpus spongiosus attaches to the inferior surface of the perineal membrane, and the corpus spongiosus is that erectile tissue. So here we have corpus spongiosus. Importantly, corpus spongiosus is going to be surrounded by that layer of muscle, and surrounding corpus spongiosus we're going to have bulbus spongiosus muscle. So we have bulbus spongiosus muscle surrounding corpus spongiosus, with these structures found in the superficial perineal pouch. And then we have the other two erectile bodies, the corpora cavernosa. Each corpus cavernosum is attached again to the inferior surface of the perineal membrane, and also iliopubic rami. So we have two of these. We have our corpora cavernosa. And these corpora cavernosa are themselves covered with muscle, and that muscle is going to be the ischiocavernosus. So that muscle covering the corpora cavernosa is the ischiocavernosus muscle. So here we can see the superficial perineal pouch is bounded superiorly by the perineal membrane and inferiorly by Cole's fascia. Found within the superficial perineal pouch is going to be corpus spongiosus, surrounded by the bulbus spongiosus muscle, and the two other erectile bodies, the corpora cavernosa, which are both covered by the ischiocavernosus muscle. So to finish off this video, I just want to briefly return to the image of the pelvis we had at the beginning and draw a second transverse line across the pelvis, but this time so it goes across the anal triangle. So here we can pick up the transverse line going across the anal triangle and specifically across the rectum. If we now return below to another coronal image, we can try and have a look at the ischioanal fossae. So what we've got again are our two superior pubic rami, our superior pubic rami, and our inferior pubic rami. Again, we have our obturator foramen and obturator externus and obturator internus muscles. And again, we also have our tendinous arch from the fascia of obturator externus, and we have the levator ani muscles coursing down to the midline, where this time they have the anal hiatus. The anal hiatus is important as obviously it allows the anus to pass through, and from the anus we have the rectum. So here we can see the rectum and the anus passing through the anal hiatus of our levator ani muscles. Now previously, when we were at the level of the urogenital triangle, we had the perineal membrane present, but at the level of the anal triangle we do not have the perineal membrane, we just have the gluteal skin and the perianal skin. So here we can just draw the skin that's surrounding the gluteal region and the perianal skin. But importantly, at the level of the anal triangle, we do not have this perineal membrane. But again, similar to the deep perineal pouch, we've found a similar space that's lying either side of the rectum, and these are known as your ischio-anal fossae. So here are ischio-anal fossae. These are mostly fat-filled spaces, but share similar boundaries to that of the deep perineal pouch. Laterally, there is going to be the obturator internus fascia and the inferior ischiopubic rami. Medially, there's going to be the sloping walls of levator ani muscle, and also the external anal sphincter, which is located within the perineum, just inferior to the pelvic diaphragm, and we can see it straddling the anus here. So here we have our external anal sphincter. And like I said, inferiorly, instead of the perineal membrane, we have the skin of the gluteal region and perianal region. The ischio-anal fossa are important as they actually allow a nerve and an important artery to go through the ischio-anal fossae to supply the anus. And what we have is running along the medial side of obturator internus is the pudendal canal. This is a fascial canal that contains the internal pudendal artery. Here we can see it in cross section, so again this will be running through the screen towards you, the internal pudendal artery and also the pudendal nerve. These structures are running in what's known as the pudendal canal. So we have the internal pudendal artery and we have the pudendal nerve, and these structures are running within the pudendal canal. The pudendal canal is located along the lateral wall of the ischio-anal fossa along the medial surface of obturator internus. And coming from this artery and this nerve is the inferior rectal artery. So we can see it running through the ischio-anal fossa. This is the inferior rectal artery, and also coming from the pudendal nerve is going to be the inferior rectal nerve. We have these running through the left hand side, and we are also going to have these running across the right hand side. So here we can see the ischio-anal fossae, these fat-filled spaces positioned on either side of the anus and the rectum, share similar boundaries to that of the deep perineal pouch. And actually the anterior aspect of the ischio-anal fossae on either side extend into the deep perineal pouch to sit either side of the urethra.